Thank you for attending our presentation on interlibrary loan and document delivery in health sciences libraries during the COVID-19 pandemic. I'm Kristine Alpi, University Librarian at Oregon Health and Science University in Portland, presenting on behalf of our multi-institutional team and my co-author Elizabeth Meyer. Our contact information is also on the last slide. We will share our plan and progress as outlined, starting with the motivation in our health sciences context, spending more time on our research questions and study designs. There's more detail on the slides than I can possibly cover in this 7 minutes. We want to know how our experiences with scoping and delivering ILL and DD services in libraries compared with those of others. There was an August 27th webinar, Has the Pandemic Changed the Future of Sharing, Resource Sharing? And that was very helpful in terms of comparing our experiences with others. We saw an increase in volume of requests, and we wanted to know, was more health and science content needed during COVID, or was the same information need just being met by fewer libraries, or some combination? At the OHSU library, requests were up from peer libraries unable to access their print collections, but few were for COVID-related content. This fits with anecdotal reports that about 1/4 of the academic health sciences resource libraries were still going in to scan from their print collections. But the biggest question that motivated this research was, what are you doing about articles that you can't get through ILL? We want to ensure that libraries can access these materials going forward. We've included this slide on health sciences library context for conference attendees who may not be familiar with these health sciences organizations or the DocLine system. Pause here on the video if these are new to you. Interinstitutional research takes a team. I contacted the OSL libraries and the Medical Library Association resource sharing and research caucuses to collaborate by asking would they want to be on the research team, share questions for consideration by the research team, or share data when we were more organized and ready to receive it. The final team consists of people from 11 health sciences libraries, including 2 hospitals, and we cover a broad geography from Northwest Oregon to Florida in the Southeast, with several also participating from New York and New Jersey. And the roles of the team members professionally come from access services and resource sharing, instruction and reference services, and administration. There's also a variety of research experience throughout the group, and so this is a learning experience for all of us. When we started this project, I had pitched it as a print collection usage study, and in the dialogue and interest from those with digital-only collections about borrowing, we evolved this to studying ILL and DD more broadly. These are our research questions currently, and I'll summarize them, not reading all of the sub-programs. How did COVID quarantine and library closures affect document delivery, volume, and subject matter? And once we know what people requested, are these materials available online for purchase? How can we characterize local collection usage during closures? What about materials that aren't able to be filled? And what were the decision-making and workflow adjustments made, and what could we learn from these? So as these questions interrelate, our plans included phases of data collection led by different subgroups on secondary data, primary data, and the survey. I coordinate with all of the subgroups, and each group influences and informs the others. Team members are listed by their group with an asterisk by the team leaders who handle the remote coordination that's necessitated by such a geographically diverse team across 3 US time zones. We work asynchronously and collaboratively in Google Drive, and study-wide contributions such as reviewing this presentation, the survey, and protocols ensures that all of the research team become familiar with all aspects of the project. I start with the secondary data analysis team because they plan to gather and analyze aggregated borrowing data, partnering with systems to compare the local data with national trends. This has been more challenging than anticipated, and this group will also lead the follow-up analysis of subject area, cost, and digital accessibility on the bottom of the slide, regardless of whether that is from primary or secondary data. The primary data collection analysis team is focused on gathering and analyzing local borrowing and document delivery data that wouldn't be available in larger systems. And the Workforce Survey team is designing an instrument with several types of questions relevant to resource sharing staff and administration to be completed on a per library basis. We worry that the sheer amount of COVID-related research means that libraries will not want to participate. We also want to address potential concerns about data privacy and quality. Each team has had data privacy issues under discussion. For example, the Workforce Survey. We've made it anonymous. This limits the detail that our demographic questions can ask about institution type and location, because combining these might identify the library in a state that has few health sciences libraries. As human participant research, our survey will undergo institutional review board review. The secondary data team is working through the need for signed institutional participation agreements to be able to release system aggregated data. And the primary data team is determining whether automated reports have sufficient data so that custom reports and the associated cleaning and de-identification can be limited. Research integrity oversight will be coordinated at OHSU, which is providing the registration, training, and review for these projects. Our next step is to distribute the survey to health sciences libraries by the end of October. The survey instrument will be available to others who wish to study interlibrary loan and document delivery in their context or region, and we welcome your feedback on our research. Thank you for listening, and please contact us or we'll see you at the Q&A at the live program. Thank you.